As spring begins to blossom, life enters a new season in more ways than one.
I think we're there.
Bob McDonald is the executive director of Denver's Department of Public Health and Environment. On Thursday, he and public health administrators across the country will no longer have to work under a COVID-19 public health emergency.
All of us came together and we got through it.
But just because the pandemic is over doesn't mean the virus is gone. But it does mean some benefits are.
When somebody wants to get tested, whether that's an at-home test or if they seek that testing through the healthcare provider, that's probably the biggest change.
Effective May 11th, insurance companies will no longer have to cover at-home COVID tests. And if someone wants to test at a hospital or doctor's office, it'll likely cost more. The requirement stopping insurers from charging copays or any other fees related to COVID-19 testing ends with the pandemic. So do the state's bus vaccine clinics.
Now, the good news here is that a lot of treatment and vaccines, especially even after May 11th, are still free. That's considered preventative. That is still covered and is the best control, regardless of how things are covered financially.
But even as the world enters this new season, some things will always remain.
No, it's not going away, and it never will.
Jaleesa Rosari, 9 News.
The federal government is still offering free at-home test kits that can be mailed. Many of those kits people have stocked up on have an expiration date, though, that were recently extended. The FDA has a running list on their website.